Fat grafting. It's a very commonly done procedure today in facial cosmetic surgery. Now, when you want to start a practice in fat grafting, many a times I have been asked this question, what are the equipments which are required if I want to do, for example, a submental liposuction, or I want to do fat grafting from the thigh, from the abdomen, from the flanks, and I want to transfer the fat into the face. Friends, ultimately with my experience, what I have done is basically I've tried to assemble in a small box all that is required to do a fat grafting procedure in your head and neck area. Now, let me just explain you this and how I have compiled it, and it's going to be a simple, straightforward thing and your armamentarium which can help you to do fat grafting onto the face, or you want to do submental liposuction. Now, the first thing which you would require when you want to do, say for example, submental liposuction is this kind of two cannulas. The first cannula is basically the injection cannula, which is going to be a 2 millimeter cannula, which is 10 centimeter in length. Now, this is going to help you to inject the tumescent solution into the submental area. Second is going to be your 2 millimeters liposuction cannula. Now, if you see the holes, they are totally different. So, this is going to be for your injection, and this is going to be for your harvesting or doing the liposuction. Now, this is a lure lock system which gets attached to a 10 cc syringe. Now, since this is lure lock, what you have to do is, all you have to do is just snugly fit it into this, and then you can take either the tumescent injection, or if you want to do the when you want to harvest, you're going to be taking this cannula and you're going to be putting this, and once you have put this, you put it inside the tissue planes, and then you create a negative pressure. Now, what is required here is going to be this kind of a stopper. So I have created this kind of a stopper which will fit into a 10 cc lure lock syringe. So this goes and fits here. If you see here, this will go and fit here, and this is going to help you to create a negative pressure so that you don't have to hold the back part of the syringe. So it easily stops it here and creates a negative pressure, and you can easily do the liposuction from the submental area. Okay, so now next is when you want to harvest a fat from the abdomen, from the flanks, or from the thigh, and you want to transfer it onto the face either as macrograft or a micrograft, or you want to use a nanograft. Now, what is going to be required for us here are these two kinds of cannulas. Now, these two cannulas, if you see, they are longer, they are 16 centimeter in length. So the first cannula is going to be your injection cannula, which you will be using it to inject the tumescent solution. So you want to do a wet liposuction. So you want to push in a lot of tumescent solution either into the thigh area or the flanks or the abdomen. So this is going to be helpful for you, and you're going to be injecting a lot of tumescent solution. Once you have done that, so you're going to be waiting for about 5 to 10 minutes, and then you're going to be using this aspiration cannula, which is going to help you in harvesting the fat. So if you see again, the holes in this are made in such a way that they can easily harvest about 1.5 to 2 mm of fat here, if you can see here. Okay, now here again, this is lure lock. So this is precise fit with a 10 ml syringe, and now what you have to do is create a negative pressure and again use this stopper here. So, and then you fit it here, and this is going to keep the negative pressure on while you are, kind of aspirating when you are harvesting this. Okay, so once you have harvested and the fat is there in your hand, so you make it, kind of 8 or 10 syringes, how much ever you want to, kind of inject. So it is. So how you're going to be processing is, I would recommend that we decant it. So once we have decanted it and we have separated the blood and the oil, so the fat which is there, now we have to, kind of use the transfers to make the macro or micro or nano. So what I have done here is actually got 4 transfers. So this transfers starting from 2.5 to 1.5 to 1. So when we transfer it from the 2.5, all we have to do is, this is the fat, for example, what you have to do is use this lure lock, and then you lock it onto the other syringe here, and this gets locked, and you pass it through this. So you pass it through the transfer here, and once you have passed it through the transfer here, so if you want, for example, macrograft, macro fat, so you will be transferring from the 2.5. You want micro, then you will be transferring from the 2.5, 2 and 1.5. And then if you want to do the nano, you would finally be transferring it through the 1 mm cannula, and you would be passing it multiple number of times till you break the fat, and what you actually receive at the end is the stromal vascular fraction, or the SVF, which actually doesn't volumize. It is helped to regenerate the skin or your hair. You can inject it at the subdermal layer, so in the intradermal layer, and that helps in the collagen induction and helps in rejuvenation. So what I have done here is to make life easy for my fellow surgeons and my colleagues. So I have compiled and have assembled this four. They are made up of anti-rust stainless steel, and they have leak proof, and they can be used, they can be autoclaved, and they can be used in n number of surgeries. All you have to do is just keep on cleaning and you keep on autoclaving it. I hope this helps all my fellow surgeons and colleagues in starting their practice into the fat grafting. If you want to know more about this kit, please get in touch with us and we will be ready to help you.